Hello, I'm Dr. Ali. I'd like to welcome you back. We know that when you improve your health, you improve the quality of your life. And our goal for you is to bring you the knowledge and resources that you need to empower yourself, your family, and your community. If you're joining us for the first time, make sure that you subscribe so you can make informed decisions and changes to improve your mind and your body. So, what I have brought to you today is an important question that was researched by a group of scientists. The question that they asked was whether vitamin D deficiency can lead to death. This is part of our segment called New Research, where we bring new research to you. So, let's start talking about vitamin D itself. So, most of us think that vitamin D is a vitamin. It is a fat-soluble vitamin and it belongs to a family of compounds that includes vitamin D1, D2, and D3. However, it is not a true vitamin because, as opposed to the other vitamins, this vitamin can be synthesized by our body while the other vitamins cannot be synthesized by our body. So, vitamin D has the chemical structure of a steroid molecule and it is derived from cholesterol. And it is very similar to adrenal and sex hormones. Now, why is vitamin D considered a hormone? It is considered a hormone or a prohormone because it has multiple functions in the body and it contributes to many different metabolic processes in the body. Why do we find vitamin D to be so critically important? So, one of the most important reasons that vitamin D is very important is its role in bone health. One of the jobs of vitamin D is to help our digestive tract absorb the calcium and phosphorus from our diet. These minerals are essential in building and maintaining the strength of our bones. Low levels of vitamin D have been linked to stress fractures, osteopenia, and osteoporosis. The second very important function of vitamin D is its immune function. We know that vitamin D is critically important for our immune system. Those with low vitamin D will have frequent infections. They will also be at risk of developing autoimmune diseases, and they will also be more at risk of developing cancer. Remember that cancer is connected with our immune system not functioning adequately and removing the damaged cells from our body. The third and very important role of vitamin D is in mental health, and we will talk more about it later. So, what are some of the sources of vitamin D? Certain foods naturally contain vitamin D, such as salmon fish, sardines, mushrooms, and yogurt. It can be hard to get enough vitamin D through food. So we have another way where we can vitamin D, and that is through exposure to the sun. Now, the limitation to that is people who live in places which have long winters may have a problem with getting enough vitamin D through the sunlight because winter sunlight does not have enough of the UVB component that is essential for vitamin D synthesis. Also, we have to remember that individuals who have issues with their digestive tract, such as irritable bowel syndrome, may have trouble with absorption of vitamin D and may need to supplement vitamin D. Vitamin D is called sunshine vitamin because you can get it from the sunshine, but we have to know that there are a number of variables which determine how much vitamin D can you synthesize through the sunlight, and we will talk more about that. So let's talk about how much sunlight do we really need to get adequate vitamin D. In general, 15 to 20 minutes of sunlight several times a week can help us get adequate vitamin D. However, having said that, as we have said before, that it depends on a number of factors, such as skin pigmentation, latitude, time of the day when you're exposing yourself to sunlight, aging, and clothing. Clothing will prevent synthesis of vitamin D because your skin has to be directly exposed to the sun. We also know that dark-skinned people need 6 times more sun than white-skinned people to get enough vitamin D. On the other hand, dark-skinned people have less chance of developing cancer. What are some of the symptoms of vitamin D deficiency? So one of the most important symptoms, as we have talked about before, is fatigue or tiredness. There could be bone pain, that could be muscle pain. There is also a possibility of having muscle weakness. Individuals with vitamin D deficiency can have acne and they can also have depression. The National Health and Nutritional Examination Survey confirmed that people with vitamin D deficiency are at significantly higher risk of depression than individuals with normal levels. Diagnosing vitamin D deficiency is very easy. A simple blood test can tell us what is the level of vitamin D in our body, and depending on the level, you can increase your intake of vitamin D. If you feel that you are somebody who is at risk of osteopenia or osteoporosis because you've had low vitamin D for a long time, then you can also get a special scan of your bones to find out if you have osteopenia or osteoporosis. Now, the question we talked about in terms of can vitamin D lead to increased death was a question that was researched by a group of scientists and published in the journal Annals of Internal Medicine in November 2022. Now, the research was carried out in the University of South Australia. And it was a research which included 300,000 UK biobank participants who were followed up for a 14-year period. And they found that the prevalence of severe deficiency in these individuals ranged from 5 to 50% of the population. Now, all of these people had measurements of their vitamin D. Results of the study. There were 18,700 deaths during the 14 years of follow-up. Interestingly, they found that there was a direct relationship between low vitamin D and increased mortality. They also found that the risk for death decreased steeply with increasing concentrations of vitamin D until 50 nanomoles per liter. They found that individuals with low vitamin D had high mortality from cancer, cardiovascular disease or heart disease, as well as respiratory diseases. So now we know that vitamin D deficiency is a significant risk factor for death from all causes, in particular, death from respiratory diseases, cancer, and heart disease. So what we need to do is at this point in time, we know that the level of vitamin D that we want to target is 50 nanomoles per liter or more to reduce the premature risk for death associated with low vitamin D. So what can we do to improve our vitamin D levels? So the most important thing is to get your vitamin D levels checked regularly. You want to ensure your diet has adequate vitamin D. Expose yourself to the sun every day for about 20 minutes. If you have risk factors which make it difficult for you to get your vitamin D through diet or sun exposure, then you can supplement it with a vitamin D supplement of good quality. Make sure that you have vitamin K2 added to that supplement. Thank you, and we will connect next week.